Do you know a family member with heart disease? And do you know how it impacts their life? Well, in my PSA, I'm going to go over some general statistics of heart disease, how it starts in the first place, how to treat it, and ultimately, how does heart disease affect your life? So what are some general statistics regarding heart disease? Well, the CDC, or Centers for Disease Control, claims that in 2015, heart disease was the #1 leading cause of death in the United States. And this killer disease claims 1 out of every 4 deaths. Some more stats also find out that someone in the United States suffers from a heart attack every 34 seconds. And within every minute, someone dies from a heart disease related event, whether that be from stroke, cardiac arrest, or a heart attack. Heart disease also claims more lives in women, making it their #1 killer. Also in women, while 1 in every 31 deaths is contributed to breast cancer, 1 in 3 are contributed to heart disease. So when you look at the scope of this disease, it's probably bigger than you previously thought, because the CDC also claims that heart disease claims more lives every year than all forms of cancer combined. And speaking for healthcare, 1 in every $6 is spent on the treatment of heart disease. So not only is it making an impact in our lives physically, but as well as financially. So how is heart disease caused? Well, the most common factor contributed to heart disease is called atherosclerosis, which is plaque buildup of lipids in your arteries that once built up in certain spots, it decreases blood flow through your heart and through your vital tissues and organs. There's also many risk factors that contribute to heart disease. There's preventable ones and non-preventable ones. Some of the preventable ones are things such as diet and exercise that really creates a big impact, and doing things such as smoking, and also staying away of your body mass index, because having a 35-inch waist or above puts you at higher risk for having heart disease already. And there's also non-preventable risk factors such as having a family history of heart disease and having those genetics go through your family. It also having something such as diabetes can help contribute to a risk factor that can give you heart disease. And with all of these risks associated with heart disease, every risk doubles your chances, and with every risk added on above that, it just multiplies it and multiplies it. So what can we do to treat heart disease? Well, since it's an incurable disease, you're going to need to make lifestyle changes. And doing things such as exercising more and eating a better diet helps, and also being aware of your mental health can make a great impact. There's also procedures and medicines that help treat heart disease. One of these procedures would be a stent placement, which is a thin wire that's placed in the arteries that helps prevent blood from clotting, and this is kind of like the spring that's in a ballpoint pen. There's also ICDs, which are implantable cardiac defibrillators, and these are electrical pacemakers that are implanted under the skin, and these send an electrical shock through the heart if the heart ever decides to produce an arrhythmatic beat, which is not constant beat, and it's also helps for those who are experiencing cardiac arrest. There's also many medicines for those that are experiencing heart disease. There's medicines such as antiplatelets. These are agents that keep blood clots from forming by preventing the plaque from building together in the arteries. There's also anticoagulants such as warfarin and other blood thinners, and these decrease blood clotting because they thin down the blood, which makes it easier to flow throughout the arteries. There's also vasodilators, and these are considered to be called nitrates, and these are very important, and people that have a more developed heart disease are told to hold them around at all times because these help decrease angina, which is intense chest pain, and these increase the supply of blood flow and oxygen to the heart and also other parts of your body. And there's also cholesterol medications. These just help the body lower the LDL or bad cholesterol in the body, and this the bad cholesterol actually is a way that plaque is formed, because the cholesterol, once it builds up, it's so thick that these platelets and plaques start building up in the arteries. So lowering cholesterol and taking all these medications and other procedures help prevent it and treat heart disease.
Hi, my name is John. I'm Wyatt's dad, and I've had a heart attack. Happened to me about 8 years ago here in this house. Ambulance ride to the hospital. Ended up getting 3 stents and a pacemaker defibrillator. Really thought my life was over at that point, but it wasn't. I had to learn to live a little differently. I don't do all the things right that you're supposed to. I take 4 pills in the morning. I take 3 pills at night. I have to learn to deal with the depression that goes along with not being able to do all the things I want to, or all the worries that go with what could happen next. I need to keep moving on though. I need to take care of my family. I need to go to work. The world doesn't stop because John had a heart attack. I've been trying to exercise lately. Been riding bike. Got up to 12 miles in an hour. I think that's pretty good for starters. Looking forward to this summer and being able to bike outside. I've been biking inside at the gym. Carry nitroglycerin with me. I've never had to take it, but it's there if I need it. I guess I just have to learn to live with the things that come with my issues. I guess that's how it has affected my life.
I hope that after this, you will all have a better understanding of how heart disease works and how it affects life. Remember, your heart is like a vase, and when you compromise its health, it'll never be the same.